Thank Bin and Joyce for the wonderful report from Philippines. Hello, everyone. I'm Katherine Ho, the Senior Communication and Patient Engagement Manager at Novartis Taiwan. Today, I'm excited to share the Taiwan APPISx journey joined by Professor Sharon Hsiao, a valued partner of APPISx, distinguished pharmacoeconomics expert and a committee member of the Pharmaceutical Benefit and Reimbursement Scheme, PBRs. Before Sharon's sharing, I would like to give you the background of the Taiwan APPISx journey and why we want to make a difference for patient engagement in the HTA process. Taiwan is a single-payer market which has long involved patients in the HTA process. Despite the framework for patient involvement, like having patient input before the HTA assessment and having patient representatives sitting in the PBR's meetings, a formal representation is still lacking, and the patient advocacy groups feedback that patients' opinions are not adequately discussed in the assessment process. So with that, in 2022, we have invited Professor Sharon Hsiao, who is both a scholar and a representative of the PBR's committee, to join the APPISx. Over the past 2 years, Sharon has led the patient groups to deep dive the opportunities toward making meaningful patient engagement in the HTA process. Now, I would like to invite Professor Sharon Hsiao to share the achievement and the journeys with the APPISx and our upcoming plans. Hi, Sharon. It's great to have you here today.
Hi, Katherine. Thank you for the invitation.
Hi. Before you begin, can you tell us why you accept Novartis' invitation to join the APPISx and what have been accomplished in the past 2 years?
Thank you, Katherine. That is very good question, but it's also a very simple question. I just think that the APPIS is a very good opportunity to work with patients, and that is very meaningful. So I joined the APPIS. So in the following slide, I'm very happy to share with you how I work with APPIS in the past 2 years to get patient involvement in the HTA assessment process. So the journey started from 2022. In that APPIS meeting, I was invited to share the HTA case studies from the UK and Canada. During that meeting, we do have a thorough review regarding 2 examples from the UK and Canada to see how patient opinions can be get involved during the policy shaping process. So after that, I'm also very honored and pleased to work with 2 representatives from the local patient groups. That is Jen from the Formosa Cancer Foundation. Another one is Dr. Wang from the Hope Foundation. Both of them work together with me, and then we first of all summarize the case studies we learned during the APPIS meeting, and we add more local status and prospects from our patient groups to address the current barriers and hurdles they faced during the HTA review process. Of course, we set up some challenges we need to handle in the following years at that paper. At the end, all of us co-authored and published an article in a medical journal here in Taiwan. And we think that is a very good example that academia can actually work with patient groups and come out of meaningful journal papers that make the public know more about how patient groups can have their opinion to be addressed during the policy shaping process. And as you can see from this slide, we all thank the APPIS for the great opportunities to make us work together. So for the following year, based on the journal paper, because we address some challenges that need to be addressed for patient groups. So in 2023, that's last year's APPIS, we conducted a survey with patient groups to see whether they have any challenges or hurdles that need to be taken care. So as you can see from the slide, we address some barriers that need to be taken into account. And during that year's APPIS, there's another innovative activities is that we invite the Center of Drug Evaluation, our local HTA bodies, to share how they are going to work with the patient groups for more patient engagement during the HTA process. So this year, based on the two achievements from the last 2 years, for this year's APPIS, we decided to do the patient as per training and educations. And hopefully these activities will help to fill the knowledge gap of patient groups and help them to get more involved during the HTA process. So I think that's my journey in the past 3 years with APPIS. So I'm going back these to Katherine. Thank you.
Thank you, Sharon, for the fantastic sharing. What I would like to add is our focus with the APPISx has been on shaping policies within the public health insurance for years, because the HTA process is crucial for new drugs to be covered by national health insurance, which covers 99% of the population. Now coming to the end of this session, I would like to invite Sharon to share your thoughts with the APPISx journey. This is your third year participating in the APPISx. How does it change or inspire your thoughts on patient engagement in health policy? And how do you think patient groups can better establish a trusted, collaborative relationship with other stakeholders?
Thank you, Katherine. I do think APPIS is valuable and meaningful to me because being working in academia and sitting in the community meeting for review the health technologies. The APPIS is truly a great opportunity for me to learn from patients. So in the past, I think I do not have so much chance to talk with and work with the patient groups. So I think that is a good start and hope we can work together more to make our patients' voice to be heard. Thank you.
Thank you, Sharon, for today's sharing, and I hope everyone enjoys this session and look forward to more exciting patient engagement case sharing in the region. And thank you for your attention. Next up, we will have a report on APPISx India by Ram and Farah. Over to you, Ram and Farah.